in reversing chronic diseases. With an MBBS from Netaji Subhash Chandra Bose Medical College and advanced training from institutions like Apollo Hospitals and Harvard THN School of Public Health, she brings a wealth of expertise to her practice. Dr. Sanchita is also a certified health and life coach and an accomplished speaker, sharing her insights on lifestyle management and nutrition at medical forums worldwide. Her best selling book, Holistic Health Over Medicine, reflects a passion for empowering patients to achieve lasting health through holistic care. Lastly, I would like to introduce Dr. Bijli Nanda ma'am. Dr. Bijli Nanda ma'am is an MBBS with an MD in physiology with more than 15 years of teaching and research experience. Her research areas have been exercise and brain function. She is a board certified lifestyle medicine physician. She is also trained in palliative medicine and care from TIPS, AIMS, and CancerPod. Also, she is a SETI trained cancer exercise specialist. Currently, she practices lifestyle medicine and palliative medicine at the My Health Clinic, Noida. I welcome you all. Thank you so much. Now, I would like to start with the first question to Dr. Pratima Kinni ma'am. Could you please, the first question is, could you explain how uncontrolled hypertension damages kidney structures and what specific components of a diet counteract these mechanisms to protect kidney function? Over to you, ma'am.
Yeah, can you hear me?
Yeah.
Yes, ma'am. Thank you, Dishna, for the introduction and the question, and to Pan India for giving me an opportunity to work on this. Of course, hypertension is something that is the leading killer and the main cause for the cardiovascular disorders that we are seeing. And when we see the relationship between hypertension and kidney diseases, they go kind of hand in hand. They are like a married couple. If one is unhappy, the other one is unhappy too. And it says that BP goes with the kidney. So can we have that one slide? I just have a couple of slides to explain what I'm saying. Dishna, if you can please upload it.
Yeah, I have uploaded. One second, I'll just check.
Yeah, so just to go on with what happened, I'm just describing what a hypertension is. Each country, I believe, has a different definition, but what I'm following is the American definition, where the normal blood pressure is 120/80. Anything that is above in the systolic part, that is, if it is between 120 and 129, we call it as the elevated blood pressure. And in the stage 1 is when the systolic is between 130 to 139, and or the diastolic is between 80 and 89. We call it stage 1. And stage 2, if it is above 140 systolic and above 90 in the diastolic range. Are you able to put up the slide, Dishna?
Yeah. Give me a minute again.
Can you put it on slideshow, please?
Yeah.
Deshna ma'am, you will have to close this slideshow.
Yeah.
Yeah.
Only after that.
Okay, so hypertension can affect kidneys, and the kidney disorders can also affect hypertension. They kind of have a two-way mechanism of acting. Now,
is it visible now?
Yeah. Now it's come.
Okay.
You'll have to put it in the slide mode. So, in the presentation mode. Yeah, click once and click again. Yeah, so that's the hypertension I was talking about. Yeah, and this is a nephron. Just to show how the effect of the hypertension can affect the kidneys. Now, this is a efferent arteriole, which is, we know the nephron. We have the Bowman's capsule, and then we have the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, and the collecting tubules of the kidney. This is a unit of a kidney. So when a there is high blood pressure, when there is hypertension for whatever reason, the efferent arteriole, that is the arteriole that is entering into the glomerulus over here, it modulates, it kind of modulates its diameter in such a way that whatever the high pressure with which the blood is coming into the kidney is not transmitted into the glomerulus. So that the glomerulus and the efferent artery and the rest of the perfusion for the kidney does not get affected. So it is actually having a protective mechanism. Now, if this hypertension for some reason goes unabated, it is chronic and there is no control on this, then this efferent arteriole undergoes its own damage. One thing is, it is not able to dilate and constrict like it used to, so that it can prevent the damage happening to the glomeruli. And it also becomes more narrow, because of the constriction of the myoepithelial cells around the arteries, and therefore it becomes more narrow, which means that the blood pressure is going to become more. So because of this, the high blood pressure is transmitted into the glomeruli, which causes damage to the glomeruli, and there is less blood flow going into the efferent artery. Now, the efferent artery then is going around the tubules of the, it is going around the tubules of the rest of the nephron, right? So when there is less blood supply that is coming because of the damage that has happened over here, the kidney thinks that there is less blood in the body. Now, because of that, the renin system comes into action. The renin is secreted from the kidney. The renin then goes and acts on angiotensin, which is secreted by the liver, and this angiotensinogen is converted into angiotensin 1 and then angiotensin 2, and this angiotensin 2 will go and try to vasoconstrict, cause more vasoconstriction, which means that it is increasing the blood pressure again. Okay, so it is kind of a vicious cycle, one leading to another. The second thing is, it is going to go and stimulate the the cortex of the adrenal glands, and it secretes aldosterone. Now, this aldosterone will go and ask the kidney to retain more salt, retain more fluid, because it's thinking that there is no blood in the body, because that is what the kidney is sensing, right? Because there's no blood coming into the kidney. So that again causes another vicious cycle. So all this together is called as the RAAS system. Okay, the next slide, please. Next slide, Deshna. So you can see this vicious cycle happening. So this is what is being triggered. Now, why this kind of damage happens in some people and in some people it does not happen? Probably genes are to be at play. So in some people it causes, some people it does not happen. Okay, so both together, one is this RAS thing happening. It also creates thirst. This RAS causes you to drink more water, which will increase the load. Okay, so one thing is, we are keeping back the salt, we are trying to keep back the fluid, we are made to drink more water, and then it also goes and stimulates the arteries to make it, to increase the blood pressure. All of this is going to cause damage to the kidney. The other thing, this, so this RAS is, all these things are happening. It then is going to create glomerular hypertension and damage to the glomeruli. So there is kidney damage that is happening. On the other state, it is going to, create what we call as a reactive oxygen state, where, there are more oxidants that are being produced because of this RAS, and this oxidative stress will have its own damage, because it is going to go and damage the tubules, the interstitial cells that are there in between the tubules, which causes renal fibrosis. So on one hand, the glomeruli are being damaged. On the other hand, this tubular interstitial, even the tubules and the interstitium is going to be damaged. So this causes renal damage. The other thing is because of the blood pressure, the endothelial cells are being damaged. So they can't produce, usually they are the ones which are producing the nitric oxide, which helps in dilatation of the blood vessels. So they are not being able to produce the nitric oxide. Plus they are, producing this endothelin 1 and this thromboxane A, which causes vasoconstriction and more damage. So this is like a vicious cycle that is happening. That's why hypertension can cause renal damage, and renal damage also can cause hypertension. So I just wanted to put up this slide because it was more difficult to explain it just without this picture. So I hope with this picture it has become clear. So this is how renal damage happens because of hypertension, because of any other cause. Now, even the atherosclerosis of the renal artery can cause the renal artery narrowing because of the blood pressure. That also can, lead to less perfusion of the kidney. The kidney thinks there is not enough fluid, and then the vicious cycle again comes in. Okay, you can stop sharing the slide, Deshna. So the second question was, how do we, by nutrition, try and reduce the renal damage, right? So like we saw, the main cause here is probably the salt. And salt is supposed to be the main culprit. And for some reason, we have excess salt sensitivity. About 50% of people who have hypertension have got salt sensitivity. Now, just a little trivia about as to why we are having this salt sensitivity is because we have come from the African region. We have originated from there. Those are really hot climates. And in those areas, it was very important for us to conserve sodium, because sodium is required for our nerve function. It is required for our muscle function. And also, if we keep sodium, we will keep the volume of the blood intact, because it's so hot we can sweat and we can have dehydration. So that's why our genes were formed to try and keep sodium as much as possible. Because another thing was that they were eating just fruits and tubers and whatever vegetables they were getting, which was not very rich in salt. In fact, their salt intake was about some, if at all, some 700 to 900 milligrams. Okay, so it was very important. It was a very not so easily available mineral, and that's why they were the genes were such that we could conserve it. But these days there is no dearth for salt, but our genes haven't changed. So any salt we get, it makes us sensitive, and that's why the hypertension burden is so much over there. So this is one thing. So we need to reduce salt in our diet. Okay. The other thing we have to do is increase potassium. Okay, because sodium and potassium are kind of in balance. One is more, one is less. So we need to increase potassium. We need to increase our calcium intake and also magnesium, because both these minerals are supposed to help in the vasoconstriction and dilatation of the blood vessels. Okay, so this is the thing. So what are the kind of foods which are rich in this? It's the plant food. Not only this, the plant food is giving you fiber also, which does not cause obesity, which will again, whatever contributes to hypertension will be kind of contributing to the renal damage. So whatever we are, diet we are prescribing for hypertension will be something that we will be prescribing for this. So what is the thing? It's the DASH diet, the dietary approaches to stop hypertension. This is the low salt DASH diet, which helps. Of course, in the DASH diet, they are telling you to have whole grains, fruits, vegetables, nuts, legumes, herbs and spices, and they allow a little bit of lean meat, low fat dairy, and some healthy oils. This is what they are prescribing. Now, we can have a completely whole food plant-based diet based on this by removing the dairy and the meat, and we can still have the goodness of the DASH diet. The other type of diet, which is almost similar to it, is the Mediterranean diet. The Mediterranean diet again includes the same thing as the DASH diet, but they use a little bit of olive oil, they use a little bit of seafood and some cheeses. Now we take that also, this is going, and a little bit of wine also they add. So you take out all these things, you will get a good whole food plant-based kind of diet. So these are the two diets that, we can think of. And the other thing we saw that there is this oxidative damage that is happening. So when we are having oxidative damage, if our internal antioxidants are not sufficient because we are not taking a proper diet, it helps to have anti-inflammatory type of foods, which are antioxidant foods. These include things like curcumin. Okay, so this is an anti-inflammatory that is there. Then there is sulforaphanes, which are present in the cruciferous vegetables. Then we have quercetin. That's another anti-inflammatory, which is a flavanol, and this comes from nuts and red onions, grapes, plums, apples, those kind of things. So all these are plant-based only. Then resveratrol, which is coming from nuts and grapes and a little bit of red wine also. Then from coffee and chocolate. Then there are something as proanthocyaninoids, anthocyanidins, which are coming from sorghum. They come from cinnamon. So all these anti-inflammatory substances help. And then we have flavanols, which are coming from green tea, and soy protein coming from the soybean. And another interesting thing I found was something called as red propolis, which is supposed to be present in wild honey. So of course, we know that honey is not something we advocate because it is equal to sugar, but this particular polyphenol is supposed to be a very good antioxidant. Maybe that's the reason why many people say honey is good, but this is one of the things that I found. So these are the thing, have a whole food plant-based diet, increase in potassium, all the antioxidants that are there, the phytonutrients that you get, increase calcium, magnesium, and of course the fiber that comes with a whole food plant-based diet. And low sodium. This is what I had to tell about the answer.
Thank you so much, ma'am. Over to you, Nitish, sir.
Thank you so much, ma'am, for thoroughly explaining the pathophysiology of role of hypertension in kidney damage, and also sharing the insight how to prevent it with a plant-based diet. Now my second question is for Dr. Sanchita Bhattacharya, ma'am. Ma'am, how can clinician strike a balance between adequate protein intake and the need to limit protein in hypertensive chronic kidney disease patients? And what are the most kidney-friendly protein sources to recommend? Over to you, ma'am.
Hi, good evening, everybody. Okay, so in kidney patients in CKD, basically the protein amount, the quantity of protein that has to be maintained in the first 3 stages of chronic kidney disease is 0.8 grams per kg body weight. As the kidney disease progresses further, that is after stage 3, the requirement is 0.6 grams per kg body weight. But when a patient goes on to have dialysis, of course, the protein content increases to 1.5 grams per kg body weight. So that is the quantity. Now the quality of protein. Let's look at the 2 sources of protein, the animal foods and the plant foods. Now with regard to the animal foods, when we are taking an animal protein-rich diet, the acid load on the kidney increases, leading to hyperfiltration and worsening of the CKD. The phosphorus content in animal foods are absorbed more by humans. So it's about 60 to 80% is absorbed, phosphorus from animal foods. So that has a negative impact on the kidney because as kidney disease progresses, often the body is not able to regulate phosphorus. So higher phosphorus can lead to renal, osteodystrophy. So that's a negative point of having animal foods as proteins. The third is when we are taking a lot of animal proteins, there is TMAO, trimethylalanine oxide, produced in the gut, and that causes inflammation in the gut, leading to gut dysbiosis, which increases inflammation in the body. And we know that the underlying mechanism of all chronic diseases, there is inflammation, and we don't want the inflammation to go up further. So that's another negative point. Further on, animal foods, they also have a lot of saturated fats. So saturated fats also contribute to inflammation, and it has been seen that saturated fats actually increase proteinuria, which is a risk factor for CKD, obviously. So comparing that to plant foods are very alkaline in nature. So they will not increase the acid load. Plant foods are anti-inflammatory. They have antioxidants, as mentioned by Dr. Pratima. So they will they'll contribute to the protection of the nephrons in chronic kidney disease. The gut microbiome is much more biodiverse with a plant-based diet, and therefore much more protective to overall health of the kidney patient also. Then the phosphorus that is absorbed from plant foods, because of the phytates present in plant food, the phosphorus absorbed is much lesser than the phosphorus absorbed from animal proteins. So it's about 20 to 40% in plant foods compared to 60 to 80% in animal foods. So that's another reason why plant proteins are much better. The other things that Dr. Pratima also mentioned is the fiber content. So when many CKD patients with hypertension will end up with CVD as the cause of mortality. So it's important to include a lot of fibers in the diet, and legumes, which are high sources of protein, plant sources of protein. They also have a lot of fibers. So that can protect a person from having cardiovascular complications. It will also help to remove the cholesterol, the extra fats from our diet. It will help to, decrease the inflammation in the body. So fibers has a lot of role. It will help to control the blood sugar spikes. And we know diabetes is the main cause of chronic kidney disease. Obesity is another cause of chronic kidney disease. So again, fibers help to improve the satiety, improve the volume of the food. So obesity obviously comes down. We have seen that people on a vegan diet are much more, their BMI is much better than a person on an animal food. So these all suggest, and as the Kidney Foundation, Global Foundation has mentioned that a plant-based diet can decrease mortality in kidney patients by about 21 to 27%, and that's quite significant. So overall, if we compare animal protein sources to plant protein sources, plant proteins are much more friendlier because because they're alkaline, they are anti-inflammatory, they are rich in antioxidants, they're rich in fibers, they are naturally low in fats. So that will also help with the hypertension, will help with CVD, will help in diabetic patients also, and obesity. So all in all, protein sources, which means legumes, even some vegetables, nuts and seeds, whole grains, will be a better diet for a chronic kidney patient, as even I have seen in my patients with chronic kidney problems. Chronic kidney disease is that the proteinuria starts improving, the GFR improves, the creatinine comes down. So actually, we see the results of a whole foods plant-based diet on chronic kidney patients.
Thank you so much, ma'am. Now I would like to request Deshna ma'am to continue with next question.
Yes, sir. My next question is to Dr. Bijli Nanda ma'am. How can hypertensive CKD patients on a plant-based diet safely incorporate potassium and phosphorus-rich foods like nuts, legumes, and leafy grains while minimizing risk of hyperkalemia or hyperphosphatemia? Over to you, ma'am.
Thank you, Deshna, and I think thank you, Dr. Sanchita and Dr. Pratima. You've made my answer easier because you've already talked about a few things there. So the very first thing is to look at what stage of CKD the person is, right? So in the initial stages, one does not actually see hyperkalemia or hyperphosphatemia, but that doesn't mean that the phosphate or the potassium levels are not increasing in the body, because the kidney is already trying to filter out, it's struggling to filter out substances. So the damage has already been done. So while in the initial stages, one does not severely restrict intake, one has to be a little cautious. Having said that, like ma'am said, if you are taking plant-based sources, let's talk about potassium first. You look at two things. One normally talks about bioavailability, right? So bioavailability is in the gut. But there is also something which actually I recently learned about, something known as bioaccessibility. So which is referring to the fact that due to the cell wall in plant sources, the potassium within these plant sources is not, it's very difficult to break down the cell wall even before it reaches the gut. So it is not really accessible to the gut per se, right? So though we talk about sources of food which are high in potassium, it is not necessary that what is contained in that source is actually going to the body. So traditionally, what was happening is anybody with CKD, if we are talking about protein restriction, then we are talking about restricting any source of high potassium, any source of high phosphorus. So basically, what does the patient eat then? Right? Everything is low, low, low. So that's not the way to go, because it's been seen now that because you're restricting everything, the patient starts becoming deficient in many nutrients. So while you will be restricting food, you will start giving them supplements for everything else to maintain the levels. We do know that you need phosphorus, you need potassium, you need magnesium. We need all these for, brain, muscle. We need protein also for nerve function, so many functions, right? So now, even though it's not very clear how much phosphorus should be recommended to these patients of CKD so that they don't have deficiencies and yet don't have excess. And that goes for phosphorus as well as potassium. But one major change that has happened over the years is that the latest recommendations of the KDIGO 2024, they have started saying that one must start to move away from animal sources to plant sources. So they do realize that with plant sources, even though the content of potassium and phosphorus may be very high, what's going into the body is not necessarily so high. So stay away from animal sources, one. Second thing, when we talk of plant sources, we should be concentrating on whole food plant sources. We are not talking about processed foods, because the moment these foods are processed, the content of phosphorus there becomes inorganic, which is very easy to imbibe. The whole foods just regular food that you have has most of the phosphorus in the organic form, right? So that's going to go through the whole process. If you want to break down the cell wall, then it has to be digested in the gut, and then you get something from that food. Okay. Another thing why, when you're taking these potassium-rich plant foods, like Dr. Sanjita was mentioning, they are high in alkali content, and they're also high in fiber. So both of these, again, further reduce the absorption of potassium into the bloodstream, right? Of course, if these patients are also on medications like ACE inhibitors or ARBs or even SGLT2 inhibitors, you have to be a little extra cautious. So what do? Do you restrict them? Do you tell them not to have any of these? No. You ask them to have all these nuts, legumes, leafy greens. They can have everything, but the amount should be a little less for them. They should not stick to any one source. So mix and match. Keep having different, different sources of nuts. Try to stay away from the highest, the nuts with the highest potassium, or the legumes with the higher range of potassium or phosphorus. Try to restrict that. And most important, monitor the potassium and phosphorus levels, monitor the sodium levels, monitor magnesium, monitor all the electrolyte levels every now and then. Monitor the patient. It's very important that when you have a CKD patient, you don't just give them a blanket advice and tell them to go home and do what they want to do. They need to keep coming back to you, and you need to watch for certain, watch for their symptoms. So if you're looking at these two things, then having a plant-based diet would be the safest, because at the end of the day, we need to remember we are not only looking at the kidney. We have to look at the whole person as a person, not as just one kidney patient, because you also have to look at cardiovascular, you have to look at bone health. I just want to make a point here, whenever the potassium is increased, one tends to give alkali. It is the norm. So you give them sodium bicarbonate to reduce the potassium levels. But in the process, when you give them something like soda bicarb for a prolonged period of time, it has been shown to increase the sodium levels. It increases the blood pressure. So here you are only looking at the kidney, and you send this person to the, to the cardiac department, or okay, now BP is high, now you do something. They put him on some other drugs, they come back to you. That's not what we are trying to do, or what we should do. We should look at it holistically, keep changing, keep matching, keep doing the ups and downs, so that you don't go, either into the overnutrition or into the undernutrition phase. Did I answer the question, or did I get carried away here?
No, thank you, ma'am.
Okay, I think.
Building on this, I also would like to ask you regarding
Yeah.
the hydration and the fluid intake. So, what are the key
Yeah.
challenges in managing fluid and electrolyte balance for hypertensive chronic kidney disease patients, and how can these patients optimize hydration while adhering to necessary fluid restriction? Over to you, ma'am.
Yeah, thanks. Thanks for asking me right away, because so mostly we look at patients you are dealing with a fluid overload. Sorry, am I audible? My connection keeps
Ma'am,
getting
your
unstable.
voice is breaking.
Am I audible?
No, ma'am, actually, your voice is breaking.
Is this clear now? Hello, am I
Ma'am,
audible
you
now?
can turn off your video. I think that will help.
Yeah, sorry. Yeah. Is this better? Any better?
No, ma'am, still it's breaking.
Still breaking. Just give me a second. Let me just
Now it's
it
clear, ma'am.
off. Okay. Right. So you asked me about the fluid and electrolyte. So as I was saying, normally in CKD patients, commonly we face the problems of fluid overload, right? So that's usually related to a retention of sodium. So the kidneys are not able to excrete the sodium. So there's sodium retention, and hence the fluid overload. So the very first thing that, like Dr. Pratima already mentioned, one needs to restrict the sodium in the initial stages, right? However, right now we are not restricting any fluid. You just start with restricting the sodium to about less than 2 grams per deciliter per day. But if the patient is in the severe stages, in the later stages 4 to 5, then the fluid is also restricted to about 1,000 to 1,500 milliliters per day. Right. Now, optimizing hydration. So in case there are situations where you feel the patient is losing fluid, like diarrhea or vomiting, in that case, Of course, you make certain adjustments in the fluid. At that time, you will not restrict fluid so much. Also, if they are on any medications like diuretics, you need to adjust those medications, right? So you look at what drugs the person is taking and are these like sick days. So during those times, you will change the amount of fluid that the person needs to take. Otherwise, again, what's important is if you are restricting the sodium or restricting the fluid, depending on what stage of CKD the person is, it is good to monitor. And how do you monitor? In the more advanced stages, it's good to monitor their weight on a daily basis to see if they are gaining any weight or losing any weight. Monitor for any signs of edema, either peripheral edema, or even if they come with a small cough, they should come to you and you should check for any signs of pulmonary edema, any breathlessness, any symptoms at all, new symptoms that develop. You should check for these fluid overload issues. You should also look at the urine output, and you should look for any risk of dehydration. Are they suffering from any, do they have a fever of any cause that would also lead to some dehydration? And any cause of dehydration at all, you should check for that. And of course, monitor all the electrolyte levels every now and then, right? The moment and every now and then would be if there is a change in medication, then maybe in a week or 15 days, you would be monitoring any change, plus, minus, any change in dose, right? Those kind of things one must monitor. Thank you.
Thank you so much, ma'am. Now I would like to request Deshna ma'am to continue with next question.
Thank you so much, sir. My next question is to Dr. Pratima Kidney, ma'am. The question is, how can clinicians effectively guide patients from diverse cultural backgrounds to adopt plant-based diets for CKD and hypertension management? And what are some affordable, culturally appropriate plant-based foods options that make this transition easier? Over to you, ma'am.
Thank you. As we've been talking so much about whole food plant-based diets, this thing is what applies to all patients coming from any background, any culture. This is going to be the background on which they are going to be having their diet. That being said, there are a few things that we can tell them. One thing is we can tell them that they have to prepare their own food. Most of the food which is home cooked is definitely less in salt than the food which comes from outside. And buying fresh produce is better, fresh or frozen, but not having the canned ones. So that is one thing that we need to look out for, and try to reduce the amount of saturated fat that's coming into the diet, mostly which is coming from the meat. So if we can replace this meat that is there with legumes, or you can use, instead of the paneer, we can use tofu. So try to replace wherever we can replace the animal food with the plant variety that is there. Ask them to eat more fruits, whatever that is seasonally and locally available, fresh fruits. We will not ask them to have dry fruits, because dry fruits are concentrated. So, and it's not like, you may eat one whole fruit, but you not just restrict at having just a few handful of dried fruits. You'll have much more. So the load on the body is going to be much more. So have seasonal, locally available, fresh fruits that is there. Have a salad every day. A salad prepared with fresh vegetables, green leafy vegetables, like Dr. Bijli has already, Bijli Nanda has already explained about. It is safe to have greens and vegetables in your diet when you are having chronic kidney disease. The potassium doesn't come out of the cells easily, but if you also are able to chop things like potatoes, sweet potatoes and all that, chop them fine, boil them, and then roast them and then use them in your cooking, then the potassium load is not going to be so much. Okay. So the other thing is to have whole grains so that you have more fiber that is there. And so the absorption of these potassium and thing is cholesterol and all the other unwanted things are not there when you're taking it along with fiber. And in the first place, try to avoid buying any of the unhealthy processed foods, because if it is there, then you're going to eat it. So try to avoid having it in the first place. And we have to tell them that we are only giving them the rules as to what they can eat. Like, it's like a game. We are giving you the rules, but how they play is up to them. So they can juggle around using lots of herbs and spices to replace the salt, make it more flavorful, add things like lime and some of the herbs like coriander and all that have their inherent salt. Then lime, lemon, vinegar, these can add more flavor. Add more of all the spices that we get in our kitchens. We can use them and make it more flavorable. It need not be bland, that they are not, as it is, they've been having so many restrictions. They can't eat this, they can't eat that. There is only this much of what they can eat. They have to play around their palates, make it more palatable so that they enjoy their food and not say that, oh, it's such a bland food and how am I supposed to be living? Okay. And give them time. They should get used to, eating a diet which is there for kidney disease is like a journey. It's not like something that is there today and tomorrow you're going to have it. It's going to be a journey. And Dr. Bijlinanda rightly put, we have to look at the patient as a whole and not at something that we are just treating the condition which he or she is suffering from. We need to give them a lot of attention, care, and the support and the emotional, support that we can give to them, and tell them that they can hang in there and we're all there in this together as a journey. I think that will help them go forward with whatever they want to, however they want to plan their meals around. Thank you.
Thank you so
Thank you
much,
so much.
ma'am. And I personally like that comment on making food more enjoyable, because most of the time we forget that as a doctor, as a physician, we prescribe patient eat this, eat that, but considering their personal choices and personal taste is also important. Thank you for sharing your insights. Now, I would like to ask our next and last question to Dr. Sanchita Bhattacharya, ma'am. Ma'am, are there any contraindications or concerns that clinicians should be aware of when recommending a plant-based diet to their CKD patients and hypertensive patients?
Okay. So we know like the plant-based diets are very, very beneficial for kidney health, for chronic kidney disease. And but what we mean by a plant-based diet, like Dr. Bijli also mentioned it, is that we are looking to recommend a whole foods plant-based diet, preferably organic, because the pesticides, insecticides, basically the chemicals are going to increase the uremic toxins and the acid load to the kidney. So whole foods plant-based diet have been found to be beneficial. As I mentioned, the National Kidney Foundation, the American Journal of for Kidney Disease have all stated that there is a decrease in mortality by 27% on a plant-based diet. But another study and other studies have shown that while mortality decreases with a whole foods plant-based diet, an unhealthy plant-based diet can actually increase mortality by 11%. So what we mean by an unhealthy plant-based diet is the ultra-processed foods. And the reason is because these ultra-processed foods will have a lot of phosphorus in them, like the soda drinks, the fruit juices, or phosphorus is even added to improve the taste of processed foods. So, and sometimes that's not also mentioned in the labels. So best to keep all packaged, processed, ultra-processed foods away. They'll also have high sodium in them. They will, which will increase the hypertension, which will increase proteinuria. They will be high in sugars and fats because all processed foods use these three things: salts, fats, and sugars to improve their taste and addictive nature. So fats and sugars are inflammatory. They will be the refined sugars, the refined carbs or flours. They will be acidic to the body, which will again be harmful for the kidneys. So it is best to avoid all ultra processed food, and phosphorus from ultra processed foods is 100% absorbed. From whole plant foods, it is just 20 to 40% absorbed. So that's a huge difference. If 100% is absorbed, it is going to cause a lot of problems in kidney patients. So that has to be left out. And if somebody, and like everybody is mentioning, the potassium content, we have to be a little careful when we are transitioning a patient from his normal diet to a whole foods plant-based diet. We have to monitor them preferably every week for a few weeks to see that the potassium content is not going up. Normally, it does not go up in most patients, but yes, in some it does. So then we have to do all those, take all those measures, put them on a lower potassium diet by removing some of the potassium rich foods like sometimes bananas, avocados, or decreasing the portion size, or double boiling of potatoes, sweet potatoes. That has to be done then. Or sometimes doctors even use binders, potassium binders and other phosphorus binders to control that. But overall, there is really no contraindication to a whole foods, organic whole foods plant-based diet for kidney disease. And people actually, their GFR starts improving, their creatinine will start improving, proteinuria will start improving. So it's fascinating how people can actually reverse the stages of the kidney disease that way. Thank you.
Thank you so much, ma'am. Before concluding the session, I would like to open the floor for questions from our audiences. If you have any questions, you can directly ask to the panelist, or you can put it in the chat box. Here in chat box, we have a few questions. How to reduce uric acid with creatinine 4? Can Dr. Sanchita ma'am, can you please could you please answer this question?
Okay, so to decrease uric acid is when we remove the animal sources of food, like the dairy products or meat, cheese, eggs, whatever, the uric acid will come down. And also with the, actually uric acid is also an inflammatory marker. So as we transit a patient to a plant-based diet, because they are anti-inflammatory in nature, uric acid will come down gradually. So we do not have to restrict any plant foods for decreasing uric acid. They come down even by just removing the animal sources. So that's the way to, get your uric acid levels normal.
One more thing about uric acid is the fructose intake. If they're having a lot of juices or the colas and the sugars, the direct sugars, then that also can cause an increase in uric acid. The other thing that contributes to uric acid is alcohol. So these three things can increase the uric acid. So if we can reduce that, including, the meat and the dairy products, which Dr. Sanchita was saying, those things can help in reducing the uric acid.
Thank you so much, Sanchita ma'am and Pratima ma'am. We have another question. What do you say regarding intermittent fasting for CKD patients with hypertension? On
Can you
intermittent
just
fasting.
repeat the question again?
What do you say regarding intermittent fasting for CKD patients with hypertension?
Okay, I'll just say my views because there have been studies which showed that intermittent fasting helps a lot with, for example, a patient of diabetes mellitus with hypertension, with CKD, So definitely that 12 to 14 hours of fasting is going to help control diabetes better, or even it has helped in CVD. But I think it's a patient to patient basis, because some people are very stressed with fasting. Then I would not recommend such a patient to do too many long hours of fasting if they're not comfortable with it, because stress adds up to the problem more than actually getting rid of the problem. But if a person is comfortable with intermittent fasting, they can, I think, go ahead and do it. There have been some controversial studies of intermittent fasting, making it more likely for a person to have CVD in the long term, but there has not been much, conclusive evidence as such. Intermittent fasting, I think overall is very good if you can do it, if you're comfortable with it. And basic 12 to 14 hours fasting at night is a very good habit. Or eating during the circadian, according to the circadian rhythm.
Yes, ma'am. If one naturally eats at 7 p.m. and takes his morning meal at say 7 p.m. or 7 a.m. or 8 a.m., that naturally creates a period of 12.
Some studies have even shown that intermittent fasting is not very helpful for women at a later age, and it is better for them not to do it. So that's why I guess I just go with whatever a patient is comfortable with, because the studies are very controversial.
I think what you mentioned about going by the circadian rhythm, that is a better way to the time restricted eating, right? You eat when the sun comes up and stop eating when the sun goes down.
Yes, yes, ma'am. Thank you, ma'am.
This,
There is one more question, ma'am. As most of the vegetables are applied with pesticides which are available in the market, if organic foods are not available, what washing techniques can we use for such vegetables whose skin can't be removed?
Okay. So, though all of us are not able to use, all my patients are not able to use organic produce, what we have seen and what studies have shown is that despite fruits, vegetables having some pesticides or insecticides in them, are still protective in nature. But of course, to wash off as much as you can, one can soak the fruits or vegetables in water for 10 minutes or so with a little bit of baking soda into it, which is said to, remove the toxins from there. Or sometimes even people use a little turmeric, but I think baking soda is a better option because it is known to remove toxins. So that way, at least some amount of the pesticides, insecticides does get removed. But just because fruits and vegetables or plant foods have pesticides in them, we should not stop eating them. And also we must remember that the pesticide and insecticide concentration in the animal foods is much more. Up the food chain as you go, the concentration of pesticides increases. So when we, take off animal foods from our diet, we have anyway decreased the load of pesticides in the body. And fruits and plant foods, even if not organic, have been found to have a beneficial effect, as we see in our patients all the time, that all their blood parameters, their energy levels, everything starts improving.
Questions
one question on top. Animal proteins causing acid load. Please explain.
Yes, ma'am. There is one question. Yes, can you please explain it, ma'am?
Okay. So animal foods are basically, we call that they are acidic in nature. So that pH balance is affected in the body. And the body tries to maintain a certain pH, right? So the kidneys function is to maintain the certain pH in the body. And when we are eating too much of animal foods or any acidic foods like refined, even flours and sugars, the kidney has to work more to bring back the body into balance. So when the kidney is not functioning well, when there is CKD, when it is an advanced stage, or many of the nephrons have been damaged, it is an increased load on the kidney. So that is why they have to be avoided. And plant foods by nature are more alkaline in nature. So
Alkaline.
when we ingest them, it improves the alkalinity of the body. So that is the difference that I know of. If anybody has gone more into the depth, please explain.
So there are two things. Am I audible?
Yes, ma'am. Yes.
Okay. Two things. The protein in animals is more easily digestible. The phosphorus in animals is also more easily digestible compared to plant foods. Hence, the acidic content of the animal foods becomes higher. So it's a comparison between. It's not that animal foods are only acidic. So it's these two things which reduce the amount of acid produced during the protein breakdown and the when phosphorus is absorbed. Plus also, like ma'am said, the alkali content of plant foods. Plant foods are alkaline, which is not what you find in animal foods. So putting everything together, the animal foods become more acidic in nature as compared to plant foods.
I just have a doubt here, if I may please interject. They also say that the animal food is rich in the sulfur-containing amino acids like methionine and cysteine, and these when the sulfur has no role in the body, so when it has to be taken out of the body, it is converted into an acidic substance, and that is why the acidity of the animal food. I would like to stand corrected if either of you can.
No, I think
any
you're right
light on
there
it.
also. That also adds.
Yeah. There's one more question about water, juice, and juice fasting is good for health. Or maybe just juice, water, juice, and juice fasting.
Just fasting
Yes,
is
of
good for
course. If somebody can do it, it's definitely good for health. Anybody else wants to answer? Okay, because it gives basically giving a rest to your digestive system. So juices can be very easily absorbed by the body. The digestive system does not have to work so much. You're giving a rest to your gut. And that is how it helps in the cleansing of the body, because the body can then expend its energy to do other things rather than just digesting food. So the body then uses that energy to heal itself. And that's why juice fasting can be so healing.
But I'd just like to make a comment here. If this is just for a short time, that's okay. I think that's what you're talking about, Dr. Sanchita, no?
Yeah, of
If
course.
we are talking
These are
about,
meant for
if
shorter
the question
time.
is related to CKD patients, yeah, and I mean, everyday juice, I guess we're getting rid of all the fiber. You don't want to be doing that. And also, I guess it depends, somebody having fruit juices throughout the day. There are a lot of patients I know who say, "Hum kuch nahi khate hain, sirf juice peete hain," and they're having like such a lot of fruit juice throughout the day. It's unimaginable. So I don't think that is what should be done. So Prerna, I think
Yeah.
you should be just careful there.
Yeah, it has to be a mix of vegetable and fruit juice and made at home, not from outside or something.
Yeah.
Okay. So the last question, ma'am, drinking water consumption in CKD patients should be restricted or no such restriction even when salt consumption is in check? I think that question is already answered in the
Yes, it would be a case to
description.
case. It would depend on the stage of the CKD. It would depend on the symptoms of the patient. So initially, you do start with salt restriction. You do not necessarily have to restrict fluid. Your fluid restriction only occurs later on when the kidneys are losing their ability in spite of you reducing the salt. So at that time, you would have to restrict the fluid. But then again, like I said, you're restricting the fluid to 1,000 to 1,500. You have that whole 500 range, which will depend on your patient, the individual patient. So look at all the parameters, measure the urine output, look at the sodium, potassium, look at all the electrolytes, look at the symptoms, and then you decide whether you need to restrict or not. That isn't a blanket, these are just guidelines, so you have to customize as per the patient.
Thank you, ma'am. Now I would like to conclude this session. So we in the beginning we learned that high blood pressure harms kidney blood vessels, glomeruli, and filters, and leads to consequences like activation of RAS system, which in turn lead to vicious cycle and also increase the oxidative stress and endothelial dysfunction and ultimately kidney damage and uncontrolled hypertension. But a plant-based diet like DASH diet or a Mediterranean diets, these are rich in fiber, potassiums, nitric oxides that helps to control blood pressure and protect kidney health. And then Sanchita ma'am has um, told us about the protein intake in kidneys. So in first three stages, the stages of chronic kidney disease, the protein intake should be around 0.8 gram per kg. In advanced stages, we have to reduce it to 0.6 gram per kg. But in the patients with dialysis, it should be around 1.5 gram because the protein need increases in dialysis. So we have to increase it to around 1.5 gram per kg. And animal proteins can affect negatively bone mineral density, and gut dysbiosis can also happen with animal proteins. And there are also rich in saturated fats. But whereas the plant proteins are like lentils, tofu, quinoa are kidney friendly and provide necessary nutrition while reducing the strain on kidneys and due to their anti-inflammatory and antioxidative properties. And we also then learn about the potassium and the phosphorus intake. The overall bioavailability and bioaccessibility of potassium is relatively less compared to animal or processed foods in plant food products. But the recent recommendations are also in the favor of plant sources in regarding to the phosphorus and the potassium intake. But with proper monitoring, the potassium and phosphorus rich plant foods can be safely included in the diet without increasing risk. In advanced kidney disease, monitoring the fluid intake is important, and in combination with this and also with a watchful intake of salt, a plant-based diets naturally lower sodium intake, helping to manage the blood pressure and fluid retention, and even with the hydration or fluid restrictions. A plant-based diet can be tailored to a cultural preferences using affordable, locally available foods like dals, vegetables, and whole grains, making it easy to adopt and also uh, uh, flavorable. Then though the plant-based diets are helpful in kidney disease, we need to differentiate between the healthy and a healthy plant-based diet as suggested by Sanchita Bhattacharya ma'am. Monitoring is crucial for certain nutrients like potassium and phosphorus. And I would like to add certain vitamins like vitamin B12 also. And so ensuring a balanced approach can be helpful for kidney health. And in overall, the plant-based diets are, if uh, choices are make choices are made watchfully, can help to prevent and manage the kidney disease and hypertension. With this, I would like to thanks our today's panelist, Dr. Sanchita Bhattacharya ma'am, Pratima Kini ma'am, and Bijli Nanda ma'am for making themselves available and sharing their invaluable insights with us. I would also like to thanks our leadership board for making this platform available for us. I would also like to thank my discussion forum team for taking for their efforts, and the social media team for promoting our activity over social media. And last but not least, I would also like to thank our audiences for making this discussion forum successful. Thank you all, and good night.
Thank you.
Good night.
Thank you
Thank
so much.
you. Good night.